So I think the important thing is not to wait for crises to happen. I think there's a lot of work to be done to build resilience in the meantime. So recent studies by the International Labour Organization, I work with the ILO, show that 56% of the world's rural population has absolutely no access to health insurance or health insurance cover of any point, so really lack rights. And when it comes to being able to afford healthcare, up to 80% of the world can't afford access to care. So if in the best of times you can't even afford access to care, what's going to happen when a crisis hits? So I think the key is to try and actually set things up so that they're functioning day to day, and then we'll be better able to cope with crises.
Especially the area I came from, Sierra Leone, we had a terrible Ebola attack. So we see community engagement as a key building block, especially as we relate it to resilient health system. We can engage community with community health workers, can participate fully, engage community beneficiaries, change their behaviors. I think we can move forward.
The key lesson is how to build on existing strengths and capabilities in the regions where we work. I note, for example, on Ebola, that the key capacities in the world for dealing with epidemics of Ebola were based in Kinshasa in the Congo. And they were amongst the most useful teams of people in West Africa were the Congolese. They knew how communities should isolate their sick and their dead because that's how you cut the transmission chain. And that was a key insight that was not broadly known in West Africa and led to a very rapid breakdown in healthcare and health systems, and ultimately a global epidemic.
Strengthening of primary healthcare is very important, so that if we can strengthen the primary healthcare, then we can, make more our health system resilient and more stronger, so that they can cope to any shock, any emergency or any disaster. You have to make multiple approaches and make multiple partnerships to bring different stakeholders on boards and use different opportunities to overcome different barriers. So if we can, also take on board the private sector and to make linkages with the public and private sector, so it means we can strengthen the primary health care at the community level where the need is there. So it means that we had addressed the need of the community.